are still at Speak Resort Munyonyo for the Safe Motherhood Conference third edition. And before me, I have a very important person, a father, who is going to throw more light and is going to tell us what is the role of fathers in their children's lives. What are they supposed to play and what are they supposed to discuss with their children so that as a nation and as families of Uganda, we reduce the high rates of teenage pregnancy as one of the main themes for this year's Safe Motherhood. Good evening.
Good evening. How are you? Yeah, my name is Katerega Basilio, and I'm the founder of the Preterm Parents Network Uganda. Preterm Parents Network Uganda supports parents that have given birth to preterm babies. But just to highlight a few things, teenagers are contributing to the biggest number of preterm babies that we are giving. Early pregnancies, yeah, among teenagers is the biggest contributor of the big number of preterm babies that we are having. And in this process, we've lost young teenagers, yeah, which is really sad. And it's a call for the nation, it's a call for everyone to sensitize these teenagers early enough so that they don't get to that level of them being mothers or fathers, yet it's not the right time. Yeah.
Thank you so much. So, heading to the preterm babies, you'll say the young children, the young adults contribute the highest percentage. Don't they just, when they give birth to these babies, it's already psychologically stressing them, don't they just run away and leave them there?
Actually, what happens is if you move like to a hospital like Women Kawempe Hospital, a National River Hospital, we've had scenarios where we find mothers, they give birth to babies and they leave them in the NICU. Then they run away. They never come back. A week you can have about 7 mothers, teenage mothers, running away from the hospital, and they are leaving these babies. A baby is about 1 kg, quite a small, very small in size. So them, it's really scaring for them. So that's why these mothers run away, and they leave the babies in the hospital. It's emotionally draining for those who persist, but the network comes in and supports them, educates them on what they are supposed to do with these babies, and also advise them on what to do not to have another baby. Because last week, if I give you an example, you had a mother who was 12 years carrying a baby, a preterm baby, and the baby came out before time because the womb wouldn't handle the pregnancy. You understand? So as a network, we're going an extra mile to educate the youth, tell them, guys, no, 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 this is not right. uh, Educating the fathers themselves, the mothers, what they are supposed to pick with their babies or their kids to ensure that they don't get into this scenario. Yeah. We are planning also to move to schools to educate these kids that if you do this, you're coming to this. You'll give birth to a very small baby, a baby below 1 kilogram, which is really something that is we don't want as a nation. As a nation, we lose about 500 babies a week, yeah, which is a big number. And who's producing these babies? The teenagers. Yeah, so that's it.
So, basing on the scenario I've just explained of the 12-year-old, in schools we are not allowed to give out information concerning contraceptives. The main target is abstinence, and abstinence is the main thing that we preach and say. But for the 12-year-old person, we target them as primary students, and that's where teenage pregnancy is coming from and all this. So do you think it's right for us to spread the contraceptive methods also to them, or we should stick to the abstinence, yet the increasing number is around that age?
You know, people don't like the truth, but the truth is that these kids, we, the parents, have spoiled our own kids. We are giving them smartphones at an age of 5, 6 years. We are exposing them to content that they don't need to watch. In the process, they become ambitious. They want to know. In the process of them wanting to know, they end up getting pregnant. So, this is my view. Culture wise, it wouldn't be fine. But because of the numbers that we are seeing, I think it's very fine to tell these babies no. If you're going to have sex, please use a condom. Because the honest truth is that they're having it behind our backs because we've created an environment for them to do it. and we end up having them in the hospital, which is not, which drains you as a parent in the first place, because the NICU is very expensive. Giving birth to a preterm baby is very expensive. The kid doesn't have the money. Who's going to pay for that bill? You have to serve your grandson or granddaughter and your child as well. So it would be best if I tell you, please, if you ever do this, you need to do this. To have a condom on. All else, don't have it. Abstain from it. Yeah, I think we need to introduce contraceptives to these guys.
Thank you so much, Mr. Katerega. As a father, what's your say and take on fathers taking the forefront line to discuss this with their daughters, to discuss this with their sons, so that they know what to do as early as their age?
Yeah, some of the programs that we are having as a network is ensuring that there is in further involvement in the growth of the babies right when they are still preterm babies. So the reason why we are flaunting fathers is simply we want to create this connection right from birth. By the time a baby grows or a kid grows, the father is involved in the kid's life 100%. This is the only way a father will find it very easy to speak to the kid about these things, sex education. You know, it's a challenge for African parents, but I think it's time has reached when every father needs to sit with their daughter and they be extremely very open to them and tell them, hey, look, you do this, you'll have this. I call upon fathers, mothers, find time, take your baby to hold your child to a hospital. Let them look at people who are having HIV and they have refused to take drugs. Let them see what will happen to them. Find time, take them to NICUs. Show them the babies that they are going to produce if they decide to have babies when they are still young. You understand? And this should be flaunted by the fathers. So this should be the the face of this entire thing, you know? I believe it's the only way we are going to reduce early teenage pregnancies. It's the only way we are going to reduce preterm births by these mothers, these young teenage mothers. And it's the only way we are going to tell these kids, we are going to tell them, please, if you ever get to that situation, if there's no condom, don't have it.
As we've heard from Mr. Katerega, he has exposed each and everything, and he has made an emphasis that fathers are supposed to be the four fighters in this case of ending teenage pregnancy. Let's have these discussions with our children. Let's sit on a round table. Let's talk to them. All fathers of the nation, it's high time we come front and speak as he has said. Let's not fear talking about sexual reproductive health and rights, sex education to our children. Let's give them the right information, because as a parent, you can't mislead your child. As a parent, you want to see your child succeed and be successful. Let's take Mr. Kateraga's words, a founder and a father, as he has impacted and he has said his part and he has seen the rates of teenage pregnancy by himself. I remain your host, Elizabeth, and we're still at Speak Resort.